Once you have your implants or your fixed hybrid, you can eat whatever you want. There's the healing phase of anywhere from 10 days to 3 months where I want to be gentle. So, you know, break them in slowly. Sometimes I'll tell patients it's like getting a new pair of shoes. You don't want to run a marathon the first day. Doesn't mean you can't run a marathon, but we wouldn't recommend that for the first day you have.
So there's a few clinical reasons why it might not be a good idea to do a 1-day implant, but the technology is here, and actually in most cases, except those few instances, a 1 day is possible, um, and people like it. I can understand why. We all like to have instant results on everything. I mean, maybe too much sometimes.
Yeah.
But hey, what is it? So I so rudely interrupted you. What was the other options, Doc?
So another option, a more affordable option is to connect a overdenture, we call it, to two implants. So um, if 6 to 8 implants is cost prohibitive for some patients, we have an option where we just put two in and they click in with an O-ring. So they snap in and snap out. So you can take them out and clean them at night. And but they're more stable than a denture without implant connectors. So we have a option that's kind of middle of the road for patients that if they need to have all their teeth removed and they don't want the denture to be flopping left and right, and up and down, we can connect it to a minimum two implants, and at least they have more stability for chewing and not to be embarrassed if one pops out.
Okay.
So that's the middle of the road. Then the another option is to go with the traditional denture. Traditional dentures are where you remove all the teeth and you put in a plastic plate or a plastic denture, and all the teeth are replaced by a piece of plastic that comes in and out. So a lot of those patients take them out at night, um, and they don't have them at night, but they can have them in all during the day.
All right. So that's kind of the option which has been around for the longest time, and that's where sometimes the food gets caught in between on the gum and stuff like that, and whatever. Is that
Yeah, there is a possibility for traditional dentures to get food stuck underneath, and you sometimes have to use adhesive. So those are some of the disadvantages. Us speaking, usually patients have to learn how to speak with um, new dentures because they may be moving around a little bit. The the best is to have at least two implants, and 4 to 8 is even better.
right? Right. Right. I got that. Good. Well, technology is here. It has definitely advanced. Is it true that on those implants or even on those crowns or bridges, whether there's two of them or three or just one, that you can literally actually bite very normal, or should people after they have this be very careful anyhow, or like, no, just go bite into your apple, maybe don't open a bottle of beer with it, but like, do some of the normal eating stuff. Would you suggest that?
Yeah, once you have your implants or your fixed hybrid, you can eat whatever you want almost. Yeah. There's the healing phase of anywhere from 10 days to 3 months where I want to be gentle. So, you know, break them in slowly. Sometimes I'll tell patients it's like getting a new pair of shoes. You don't want to run a marathon the first day. Doesn't mean you can't run a marathon, but we wouldn't recommend that for the first day you have them.
Got it. Got it. Makes sense. Makes a lot of sense. Well, all right. Very informative, Dr. Kali. Very informative.